Assalamualaikum and hello guys. So today's video we are going to learn about the basic principle of occupational hygiene. So what exactly is occupational hygiene? Occupational hygiene is a scientific discipline that is all about people. It's about protecting them and giving them healthy and safe at work no matter what they do. Improper occupational hygiene practice in the workplace will affect both workers' well-being and productivity. What is the basic principle of occupational hygiene? Anticipation of health hazards, evaluation of health hazards, and control measures planning. These are the 4 types of industry that involve. It can be divided into 5 types, which is physical, chemical, ergonomic, psychosocial, and safety. Risk rating and classification and effect on worker health help to identify by refer the guidelines. Let us see possible health hazard on palm oil plantation. Physical hazard occur due to heat stress among workers. Risk rating and classification is about 20, which is high and could affect sweating to dizziness, cessation of sweating and collapse. Next is chemical hazard. Chemical spillage during transport fertilizer were chemical hazard that can harm the worker. The risk rating and classification is 2, which is low, and the effect is worker will get paraquat minor health problems. Manual planting is an ergonomic hazard in palm oil plantation. The risk is low but also can cause musculoskeletal symptoms on workers. Psychosocial hazards such as stress were on risk and classification high, which can give high blood pressure to workers. Lastly, safety hazard, which is sleeping. The risk and classification is medium, but also can give injury to workers' body, such as broken bones, light wrist. For heat stress, measure by exposing a wet sensor to the effects of evaporation and convection. For chemical spillage, decide who will do the assessment, identify the pesticide in use, identify person at risk, estimate risk, and identify actions. The process of repeating lifting should be assessed through interview and observation of employee work activities. Interview evaluation form is to identify the hazards, decide on action, and review. The procedure is identify hazards, mark on it, and assess the slips risk.
Iron and steel making plant industry.
Hello, can I know what are the activities carried out by this industry?
Primary steel making involve converting liquid iron from a blast furnace and steel scrap into steel via basic oxygen steel making, or melting scrap steel or direct reduced iron in an electric arc furnace. Anticipation, health hazard, and recognition activity. Recognition process involve observe workers at work, worker health records, review of past accident investigation reports, workplace inspection.
What are the possible health hazards involved in this industry?
Hello, I'm Nazmi. I'm an industrial hygienist. Let me explain to you. There are 5 types of health hazard involved in this industry. First one, physical. Noise from blower plants, oxygen plants, gas discharge blowers, and high power electric furnace affect worker health, hearing damage. Risk classification as red zone. Equipment apparatus, sound level calibrator, sound level meter, and noise dosimeter. Risk evaluation procedure. A. Area monitoring by determining noise sources and noise mapping. B. Personal monitoring. Next is chemical. Gases. Blast furnace, converters, and coke ovens produce large quantities of gases in the process of iron and steel manufacturing. Effect: red, watery, irritated, grainy, feeling on eye. Risk classification in red zone. Equipment apparatus, detector tubes, sampling tubes, multi or single gas detector, and passive batch gas sampler. Risk evaluation procedure. A. Full assessment by using CHRA method, site-specific CHRA or generic CHRA. B. Simple assessment. Next, ergonomic. Standing for long periods of time. The workers may need to standing for a long time while handling manual operation. Effect. Back pain, legs often feel sluggish. Risk classification in Redzuan. Equipment apparatus, hand dynamometer, lux meter, goniometer. Risk evaluation procedure. A. Initial ERA by proactive or reactive. The process. Static and sustained work posture should be accessed through interview and observation of employee work activities. B. Advanced ERA. Next, psychosocial. Excessive overtime. The mobile equipment on the pusher side, code side, and Larry card on top of the battery is in operation practically the entire work period, and little space is provided between it and the operation. Effect. Feeling tired, not getting enough sleep, and weak. Risk classification in green zone. Equipment apparatus. Interview evaluation form. Risk evaluation procedure. Set the interview session. Observe the workers. Identify the hazards and those at risk. Evaluate. Prioritize risk. Decide on action. Monitor and review. Lastly, safety. Sleeping. Large quantities of grease, oils, and lubricants are used, and if spilled, can easily become a sleeping on working surfaces. Effect. Cracked spine. Risk classification in yellow zone. Equipment apparatus layout. Tape procedure. Identify hazard by sketch a layout of the work area and mark on it, and assess sleep risk.
Let's see possible health hazard at road construction. Physical hazard in road construction is heat stress. The rating for this hazard is medium. Recognition process involve workplace inspection and observe worker at work. This hazard give impact to the worker such as sweating to dizziness. For chemical hazard, possible health hazard is dust and fume. The rating for this hazard is medium. The recognition process involve workplace inspection, observe workers at work, worker health records, and review of past incident investigation reports. This hazard give impact to the workers such as pulmonary fibrosis. For ergonomic hazard, possible health hazard encountered at workplace which is manual handling. The rating for this hazard is low. The recognition process involve workplace inspection and observe workers at work. This hazard give numb to the worker hands. For psychosocial hazard, possible health hazard is length of shift. The rating for this hazard is low. The recognition process involve workplace inspection, observe workers at work, worker health records, and review of past incident investigation reports. This hazard can make worker exhausted. For safety hazard, possible health hazard is road accident. The rating for this hazard is medium. The recognition process involve workplace inspection, observe workers at work, worker health records, and review of past incident investigation reports. This hazard can involve worker to death and serious injury. How to evaluate heat stress in road construction? Using wet bulb globe temperature index, we can use screening to identify thermal hazard and evaluate the risk. If score more than 5, see expert advice and more detailed assessment is required. If 3 or more parameters score more than 1, need to conduct heat stress measurement. Evaluate dust and fume, we need to use filter cassette. Gather information, divide into work unit, determine degree of hazard of chemical health, risk assessment in which work unit, evaluate exposure from all possible routes of exposure, determine level of risk, and assess adequacy of existing control measures and conclude the assessment. Evaluation manual handling by using hand dynamometer. Proactive self-assessment by employees, work risk inspection by trained person. Process keep the load close to the body for as long as possible while lifting. The heaviest side of the load next to the body. A close approach to the load is not possible. Try to slide it towards the body before attempting to lift it. Length of shift, we can determine by interview evaluation form. Identify the hazard and those at risk, evaluate their priorities the risk, decide on preventive action, take action, monitor and review. Road accident, we need to monitor by radar speed gun. Identify the factor of road accident, evaluate and prioritize the risk, decide on action and record findings.
In general, hospital headcare manage several responsibilities, including planning, directing, and coordinating other practitioners, departments, and groups. Doctors assess and manage your medical treatment, while nurses provide ongoing care. Allied health professionals provide services to help with diagnosis and treatment, and help you during the recovery process. Administrative staff work to support the day-to-day running of the hospital. The type of health hazards occurs in this industry are physical hazards, chemical hazards, ergonomical hazards, psychosocial, and safety. Physical hazards, radiation. High energy radiation of X-rays and gamma rays can be harmful to our bodies, include ultraviolet light, which can burn our skin, vomiting, bleeding, fainting, and hair loss. The risk rating is 12 and classified as medium and yellow color. Chemical hazards, gassing of anesthesia. Off-gassing of anesthesia is a gas which exposes to the worker when they prepare and administer solutions for patients. This may lead to adverse reproductive effects, shortness of breath, and cancer. The risk rating is 8 and classified as medium and yellow color. Ergonomic hazards, awkward posture. Awkward posture happens when turning or lifting patients, bathing and raising patients, and assisting in surgery. This may increases the exertion and muscle force and compresses in tendons, nerves, and blood vessels. The risk rating is 12 and classified as medium and yellow color. Psychosocial stress. Stress happens when the workers are dealing with tight work schedules, patient deaths, and face demanding patients. This may lead to low energy, headaches, tense muscles, chest pains, and rapid heartbeat. The risk rating is 15 and classified as high and red color. Safety, associated infections. Associated infection occurs by post-surgery wound infections and by pandemic infections. This will affect in long-term disability, increase resistance of microorganisms to antimicrobials, and access to death. The risk rating is 20 and classified as high and red color.
Through evaluation process and control measuring planning of hazard risk, it can be concluded that among of the industry have been discussed above, the iron and steel making plants seem need more to prioritize for necessary action. It's because most the types of hazard in that industry are exposed to dangerous to worker health, as the risk rating and classification of hazard reach more critical zone, which is red zone. Thank you for watching.